Welcome back to another Quality Analyst Group presentation. Today's topic is in reference to ancillary services and providers. The objective is to identify the definition of ancillary providers and services, share credentialing and contracting strategies, and identify the limitations for ancillary providers. Here is a list of ancillary services: rehabilitation services, mental health services, chiropractor, nutrition, audiology, hospice care, specialized centers, cardiac monitoring, social work, and DME services. Are ancillary providers required to be credentialed? Yes, ancillary providers typically require credentialing. Credentialing is the process of verifying a provider's qualification, experience, and compliance with regulatory requirements. It's essential for facilities and ancillary providers to be credentialed to legal operate, receive payments, and ensure payment safety. Credentialing for specific payers have specific credentialing requirements for facilities and ancillary providers, including those in their Medicare Advantage networks. Credentialing is a prerequisite for contracting. A provider cannot be contracted with a payer until they have been successfully credentialed and their qualifications are deemed acceptable. Why credentialing is necessary. Credentialing ensures the ancillary providers meet the standards set by insurance companies and other payers. It verifies that they have the necessary license, certifications, and liability insurance. Specific requirements may vary by payer. What is included in the credentialing? The process typically involves submitting an application with information about the facility, relevant licenses, certifications, and other documents. Some providers may also require a site visit to verify compliance and Medicare standards. Benefits of credentialing. Credentialing ensures that facility and ancillary providers are in good standing with regulatory bodies and accrediting agencies. It also helps maintain the quality of care and reduce the risk of non compliance. Phases. First, the provider would have to be credentialed. Secondly, there will be a process of submitting enrollment applications. Once credentialing and accepting payers' terms, the provider submits an application, entering a contract. If provided, the provider enters into a contract with the payer outlining terms, conditions, and reimbursements. Can ancillary providers have contracts with payers? Yes. Ancillary providers can become contracted with payers, insurance companies, and other entities that pay for healthcare services. Entering a contract, if provided, the provider enters into a contract with the payer outlining legal terms, conditions, and reimbursement rates. For example, a provider might be credentialed by a health insurance company, but they won't be able to bill the company directly for services until they have contract with the insurer, defining the reimbursement rates and other terms. Benefits of contracting with payer: fair reimbursement rates, enhanced cash flows, streamlined billing, improved patient access. How to handle payer contracts. To effectively handle payer contracts, start with a thorough analysis of your current contracts, understanding their terms and your practice performance against them. Then prioritize renegotiations. Focus on contracts with the last favorable terms or those that impact your revenue the most. Negotiate strategically, emphasizing your practice value and building relationships with payers. Finally, Continuously monitor contracts performance and adapt your approach as needed. Analyze and understand. Identify payer mix, prioritize, negotiate strategically, build relationships with payers, and monitor and adapt. Ancillary providers' limitations and actions that are prohibited. Ancillary providers, while valuable in supporting medical care, have limitations and are prohibited from certain activities. Providers must follow state and payer guidelines. Communicate with your company compliance officer, credentialing department, and or quality assurance team. All providers are responsible to know the federal, state, and payer guidelines. Here are some things that providers are prohibited to do: accepting kickbacks or finder's fees for referrals, billing for services they are not authorized to provide, operating outside of their defined scope of practice, documenting parts of evaluation and management services, engaging in activities that violate the Stark law, violating the anti kickback statute, violating Eliminating Kickbacks in Recovery Act, unlicensed practice, engaging in activities deemed to violate anti self dealing laws, offering or promoting social events as primary focus or educational activities. In conclusion, the credentialing process is a prerequisite to submitting contracting applications, also known as provider enrollment, to payers. Ancillary providers can be credentialed and contracted with payers. There are major benefits with being contracted with payers. Be sure to adhere to the payer specific contract guidelines. Key points: ancillary providers, credentialing providers, and enrollment. The difference between credentialing providers and contracting, benefits of being credentialed and contracting with payers, and limitations. Thank you and see you soon.